Thank you. Okay, so event trigger data collection. This is another example of additional things we would like to ask people to do. So currently we interview our sample members once a year, and mainly we ask them about their life now at the time of the interview. What's their situation? But there are some domains where we ask retrospective questions. And we ask them about any events that they've experienced in the time period since their previous interview. So diagnosis of new health conditions, pregnancies, births, job changes, those kind of things. And so for these domains, we try to get complete life histories over time. But that's limited in terms of what we can do, the information we can collect. It's difficult or it may be impossible for some types of data to ask those retrospectively. So if we want to ask about subjective things like how did an event influence the well-being of a person? Did this event come as something that was expected, or was it experienced as a shock? What were the person's expectations and plans at the time of the event? If we ask those questions, say 10 months later after the event in the annual interview, then what the respondent will tell us now about their state 10 months ago will already be influenced by things that have happened since, and they've become used to this new state that they're in, for example. So what they say now retrospectively will not be an accurate representation of their situation at the time of the event. And even with factual things, there might be things, so we might want to know about the impact on people's finances, or those kind of things could be very difficult to recall accurately retrospectively. So what we're trying to do is develop survey protocols that would allow us to check in with our respondents regularly and collect information about events and the influence of these events on people's lives and well-being close in time to when the events occur. So we've done a few things. We started by commissioning Kantar to carry out some qualitative research with some of our sample members, asking what they would be willing to do for the survey. Would they be willing to touch base with us regularly to tell us about life events? Under what conditions? What would we have to offer them? What kind of messaging would we have to use? And that research is written up here in this working paper. Based on that, we then also did some initial experimental testing that NatSen implemented for us, where we tested just a short question, one question that would ask about whether people had experienced one of a list of life events in the past months. So we experimented with different wording and also different ways of inviting people to this study, and that's written up here in this working paper. And then we've done an actual monthly life event study that Ipsos Mori carried out for us, and that's what I want to talk to you about today. So the outcomes of this monthly study, then looking at the different reasons why sample members did not participate in this study, and what we're doing to address those reasons for non-participation. So the life event study was a monthly web survey that we carried out during 2020, and fieldwork started every month on the 1st of the month and lasted for 7 days. We sent out invitations and reminders by SMS and by email, and then we had incentives. We offered people £1 conditionally in completing the survey, and we had a random treatment group that got an additional bonus of £2 if they reported any events, because the questionnaire would be longer for them then. And this was implemented on the Understanding Society Innovation Panel sample. We split the sample into 2 groups. We held back a control group that were not invited, and then we had a group that were eligible for this of about 2,000 sample members. But because this was a web survey, in this case, we did not invite people in households where nobody was a regular web user. And then you'll see also we had some sample members that we did want to invite. They were web users, but we didn't have a valid email or mobile phone number, so we just practically couldn't send them the invites. So the monthly invitations went to about 1,500 respondents. And you'll see actually, so we launched this monthly life event study in February 2020, And the protocols that we developed for this were then the basis for the COVID study that we then launched in April, so 2 months later. So in terms of design, they're similar in terms of the protocols. Oh, and this was the bottom message here. That was the invitation. Did any of the events happen to you last month? The SMS invitation. Right, so the first question in this survey was a filter question. Did you experience any of the following during the last calendar month? Diagnosed with a new health condition, pregnancy, changed jobs, moved home, started living with a partner. And this was a yes or no question. If people said no, then that was the end of the survey for them. So just a single question. If they said yes, then the next question asked which exactly of these events they'd experienced. And then depending on what they said, they were routed into different modules with follow-up questions about the events. So first of all, looking at participation. So this graph is based on the 1,500 respondents who we actually sent SMS and or email invitations every month. And it's the response rates across the 12 months of the study. The blue bars are the response rates. So you see they go from 52% in the first month to 57% in the last month. So a slight increase over time. The dark red bars, every month we had some people who contacted us saying they wanted to opt out of the study, and so we stopped inviting them, so they contribute to the non-respondents here. I mentioned before that we randomized, we held back a control group that were not invited to the monthly life event study, and that was because we were quite worried whether if we invite people to this additional monthly task, whether that would mean that they would then be more likely to drop out of the annual interview, that they would no longer be willing to do the annual interview. But we don't see that. So both in the 2020 and 2021 annual interviews, we see no difference in attrition rates between the group who were invited to this monthly survey throughout 2020 and the control group who were not invited. So that's good, that's very positive. So this is the monthly response rates. Then looking at within respondents, so how many of these 12 months did they complete? We have 1,000 respondents who completed at least one of the 12 months, and of those 57% completed all 12 months. So in the example column, the ones stand for a survey month that was completed, the dots stand for missing months that people didn't complete. So 57% completed all 12 waves. Then we've got another 8% that did 11 waves. And then we've got another 5.8% that have some gaps, but at most they only ever missed 1 month and then they came back again. And then we had some late starters as well. So people who didn't complete the first waves, but then at some point started completing the survey and then stuck with it. And those in part contributed also to this increasing response rate over time. So overall, 3/4 of the sample gave us complete data in terms of completing every wave or reasonably complete. But 1/4 of the sample, so we're missing larger chunks at a time, so multiple waves, or they only did very few waves, or they attrited, they just dropped out. We had a module of debrief questions in the 8th month of the survey, where we asked, we identified people who'd completed all months until then and people who had missed some months. And then we asked the people who'd missed some months whether there were months where so we said, we noticed you haven't completed all months of this survey. And then we asked whether there were any months where they'd experienced events but did not get around to completing the survey. So what we're worried about is if people are not completing the survey in months where they've experienced something, maybe because they've just got too much going on, then of course that'll affect our estimates of events. But actually only 5% said yes, that had happened. They'd had months where they'd had an event and they didn't get around to completing the survey. 82% no. And then of course some said don't know. So this debrief question isn't perfect, of course, but it gives us some indication maybe that it's not a big problem, maybe people not completing the survey in months where they've experienced events. Then in terms of reporting life events, So on average, in any one of these 12 monthly surveys, 11% of respondents reported one or more events. So 11% said yes in response to that first filter question and then reported events. So that means 89% of respondents said no, they hadn't experienced any events in the last calendar month. And for them, this first filter question, this yes/no question, was the only question in the survey. So for them, the survey was extremely short. We've looked at reporting of events in this monthly survey compared to the annual survey. So we have respondents who've completed both. And in theory, we'd like to compare, is the reporting consistent? It's a bit tricky to do because the life events survey runs through 2020. The annual interviews typically happen in the summer, so the reference periods aren't quite the same. So we've worked on the data a bit to compare. There are some types of events where the rates of reporting are similar, others, so health conditions, we're getting more reports in the annual survey. It's not quite clear why yet. We need to work on that more. Another thing we were worried about was if we invite people to report life events during the year, when they come to the annual survey, will they then still report these events again? Or will they think, well, I've already told you about this, I'm not going to tell you again. So here again, we compared the group that were held back, that were not invited to the monthly study, the group who were invited to the monthly study, and looked at the rates of reporting events in the annual interview, and we find no difference. So that's also good news. Then looking at reasons for not participating. So this is aggregated across the 12 waves, looking at the 2,000 cases who were eligible for this monthly study. So we lose 10% already because they're in households where nobody's a regular internet user. So this is a coverage problem. We're doing this as a web survey, so we have households that are not using the web. We then have an additional 15% where we don't have an email or a mobile phone number. So some of these people maybe don't have a mobile phone, but most do. They just haven't given us those contact details. So because in this study, we only send the invites by email and SMS, we just weren't able to contact them in this way. Then, of course, we have non-respondents. That's a quarter of the sample who didn't complete any of the waves. And then we've got 16% who completed some, but at most 10 waves. And then we've got those who completed 11 or 12 waves at 34%. So looking at these different reasons why people didn't participate in our monthly study, if you look at different age groups, you see that actually these reasons vary quite a lot by age groups. So this shows the y-axis. These are the different age groups. So the youngest age group is the 16 to 20-year-olds, going down to the 76-year-olds, plus the oldest group. And you see, so the colors are the different reasons for not participating. Amongst the youngest group. So this is where us not knowing an email or a mobile number is the most prevalent. So among the 16 to 20-year-olds, that's where we have the highest share of sample members where we just don't have the necessary contact details. The next age group, the 21 to 30-year-olds, that's where the non-response is the most prevalent. And then the oldest group, the 76-year-olds and older, these are the ones who are most likely to be in non-internet user households. And you see there's a big jump. You can see quite nicely that for the younger age groups, non-internet user households are quite rare. It starts creeping up a bit about at age 50, 60, but then it's really the 76 plus that are the non-internet users. So in the last slides, I want to tell you a bit about what we've been doing to address these different reasons for non-participation. So first of all, this issue that we don't have email and mobile phone numbers for everybody. We've done a few experiments in the annual innovation panel interview. So this one was in 2019. At the end of the individual survey, we have a contact details module where we ask people to check and update the information that we have so that we can get in touch with them again at the next interview. And the default way we've been doing this is that we show them what information we have. So the postal address, the landline, the mobile number, the email. And we say, can you check, is this all still correct? Or can you update if not? And what we did here experimentally is that half the sample, instead of just showing them everything, we prioritized the mobile phone number. So we pulled that out first and asked them to check that and give us their mobile phone number before then checking the other details. And the idea here was that it's probably not clear to respondents why we need different contact details for them. They probably see, oh, you've got my address and you've got my phone number, sure, that's enough. And then they don't see the need to give us other contact details. So just this prioritizing the mobile phone number, that did increase reporting of mobile phone numbers by 5 percentage points, and also emails, it increased the reporting of emails. We've got another experiment in the contact details module in the field at the moment. So here the control group is the treatment that we trialed in 2019. So we prioritized the mobile phone number. And now we've tied this question to an answer they gave earlier in the survey. So earlier in the survey, we ask, do you have a mobile phone? Do you have a smartphone? How frequently do you use the internet? Those kind of things. So here we'll say, if they said they have a mobile phone, we'll say, earlier you said that you have a mobile phone. Please, could you give us the number? So these are contact details experiments. We've done some other things not experimentally, but they've not had much effect. I'll tell you about them. So for the monthly life event study, we did actually send everybody in the eligible sample in internet user households a pre-notification letter by post. And in that, so regardless of whether we had email or smartphone mobile numbers, we sent them an advance letter saying, we'd like to invite you to this additional study. This is what it consists of. This is what we'd like you to do. This is how you can participate. This is how you'll be rewarded. And we said, we'll send you the invitations by email and SMS. And we also then showed them what contact information we had about them. So we showed their email and their mobile number that was partly scrambled, but so they could recognize whether it was correct. And we asked them to update their details on the participant website if they were not correct. But only very few people did that, so that didn't prove very, very effective. In the COVID study, we sent out the monthly, so we did the same, we had this pre-notification letter, the same approach. But then in addition, for those people where we did not have an email or a mobile number, we sent the monthly invitations by post. So we sent letters for the web survey by post. But there also the return rates, so the rates of people who we sent a letter who then actually completed the survey were quite low. So that wasn't very effective. And then a simple problem was that we noticed after a while that actually the questionnaire routing in the contact details module was such that if somebody had once refused to give us their mobile phone number, we actually never asked them again. So we've changed that, and that obviously should increase the reporting. So this is different ways in which we're trying to increase the contact details that we have. Regarding non-response, we had 2 experiments in the life event study. So I'd mentioned the incentive experiment, and here offering this bonus if people reported events. That did increase the response rates a bit, but not significantly. We also had an experiment with reminders. So we sent the invitation on day 1 of the month, the calendar month, and then we had 2 reminders that we either sent in daily interviews or every 2 days. And the 2-day intervals also increased the response rate a bit, but again, not significantly. And then finally, so this problem of what do we do with households where nobody uses the internet? So when we first started thinking about life events, actually internet use was less universal than it is now. I'll show you that in a minute, but it was also less universal than mobile phone use. And so what we were working towards was, we thought ideally if we could send this initial yes no question by text message, we could reach more people than if we set it up as a web survey, just because mobile phone coverage is higher than the web coverage. But we we ask people for their contact details so that we can contact them for the next annual survey. We don't have permission to use their contact details to send out questions by SMS. So we had to collect those consents, and we did that in the 2020 annual survey. We got a 67% consent rate, so permission to send them questions, survey questions by text message. But actually that turned out not to be so useful. So in the over 60 age group, there are only 4% who do not use the internet and have a mobile phone and consented to these SMS questions. So our hope it was that if we can send the question by SMS, that'll improve our coverage, especially amongst this older age group. But that hasn't helped much. So here, just to illustrate how things have changed, when we started talking about these life event surveys and how we would best do this, the most recent data we had at the time from the innovation panel was from 2018. And at the time, 85% of our respondents said they use the internet, I think at least weekly. And that's now increased, so using the survey from last year, to 94. So this has increased a lot in just these few years. The mobile phone coverage, even in 2018, like I said, was high, 95%, and that's crept up a bit more. So this is clearly changing over time. Okay, so to summarize, the monthly response rates across these 12 waves were stable. And well, I've put an exclamation mark here because this is really important for us. So we're trying to develop protocols so that we can implement this in the annual survey, so for real going forward. But of course, that's only sensible and if we can maintain response rates. If the response rates dwindle over time, then the data are not going to be particularly useful. So this is good. It's also unusual, I'd say, in a panel that you have response rates that creep up. I mean, they always normally go down over time. But of course, for most people, this was an extremely short survey consisting of a single question. We were very glad that we didn't have any negative effects of inviting people to this monthly survey on the annual survey, so both in terms of attrition and also reporting of events. This problem of internet coverage that we've been worrying about a lot, that really seems to be decreasing over time and possibly becoming less of a concern. The contact details we're trying to improve in different ways, but of course we still have non-response, and especially among the younger age groups. So to finish, I wanted to just flag up things that we're planning to test next. So one thing is incentivizing run streaks. So this is to encourage people to really complete every month and not to miss any of the months. So the idea is that we randomly offer everybody £1 for completing the survey, like we did in 2020. But then in the treatment group, we say, well, once you've completed 6 in a row, your incentive for completing a survey will increase to £2. So the idea is, well, to test whether that'll get people to complete more months and not leave any gaps. Then I mentioned that we sent the invitations and the reminders by SMS and email, and so far these included a link. So we had the link to the survey, the respondent had to click on that, and that took them in the browser to the web survey. So here what we're trying to do is actually embed this initial yes/no question into the actual email text or into the actual SMS. And we're still thinking of offering alternatives to web for non-respondents. So although coverage problems are shrinking, we still have non-response, and maybe offering another mode would help. There are not that many options, so we can't do this as a postal survey because of all the routing in the questionnaire, and also because of the very short fieldwork period of 1 week. Telephone probably would be too expensive, so we're exploring whether we could set this up as an interactive voice response survey. So over the phone, the respondent calls a number, they hear a recording of this first question, and then they type a 1 or a 2 to say yes or no, for example. We're exploring that. In the debrief questions, we had some people who said they thought they'd completed all months and they must have overlooked some of the invitations. Or we also had people who said, oh, they would have preferred to get the invitations by email rather than by SMS. And I guess at that point they'd forgotten that we'd said we'll send them the invites by SMS or email, depending on what contact details we have for you. So here, what we want to do in the next round is rather than just mentioning that in the pre-notification letter, actually building that into the questionnaire, and at the end of the life events study, checking in with people how they'd like to get their next invitation and making sure that we have the correct contact details to enable that. And then in the annual survey, so we have asked the consent to SMS questions again to see whether we can increase those consent rates, and maybe especially among this older cohorts. Oh, and also we're planning to debrief the people who did not take part, so the people we invited but who refused to do the life event survey, about reasons why, because to see whether there's anything else we can learn that would help us in designing this to make it easier or more attractive to participate. So that's it. Thank you.